Hello, today I'm going to be talking about polycystic kidney disease, otherwise known as PKD. So to start off, we're going to start a bit on the background about John Rublio. So John Rublio was just recently diagnosed with PKD in the hospital. His wife just found out that she is pregnant, and they're very worried to whether or not PKD is genetic and what will happen with their kid in the future. So a little bit of background about PKD. The age onset usually develops between the ages of 30 and 40. Usually with PKD, it has to deal with the kidneys. So you're going to have back pain, headaches, high blood pressure, and fatigue. With PKD, it causes many fluid-filled cysts to grow in your kidneys, which can constantly change form, creating pain. It can reduce kidney function and lead to kidney failure. And so in order to get some tests, usually would use ultrasounds, the CT scan, or an MRI scan. So now going to the chromosome pair and the genes affected by PKD. So this is found on chromosome 16, and the mutation has to occur in one of two genes, either PKD1 or PKD2. And usually, if you were to have healthy, normal kidneys, the cells would properly develop, but when there's a mutation in one of those genes, the signaling breaks down and the cells no longer develop properly and instead become cysts. Now going to preventative measures. Obviously, it's genetic, so there's nothing you can really do to prevent it. Whether you get it or not is not up to you. It's what genes you inherit from your parents. But there are some treatments that can help relieve symptoms and extend your livelihood. So some treatments could be over-the-counter pain meds to help deal with the abdomen or back pain, antibiotics, because usually people with PKD have a higher chance of getting UTIs, so antibiotics help treat that. A healthy low-salt diet, that way to reduce the sodium intake so you won't have high blood pressure, as well as an ACE inhibitor if you have high blood pressure, will help reduce that. Now going on to the prognosis. So usually by around age 75, 50 to 75% of patients with the dominant PKD usually require renal replacement therapy or dialysis, and usually they live about from 50 to 73 years, which is a pretty good life. I would say so myself. Now going on to ethical issues. This is obviously really important, whether or not in general with diseases. So my question was, should a child get tested to see if they inherited the PKD gene? Now, obviously, there's a lot of debate because people think that they shouldn't, because it'll cause a lot of stress and anxiety down the road if they find out they do and they're just waiting for the symptoms to occur. But I believe it is necessary that they should get tested, because recently they see how a lot of patients with PKD can develop high blood pressure, so it's good to know that they have PKD and they could possibly have high blood pressure. That way the doctors can monitor whether or not their blood pressure is high or not, and they can prescribe then the ACE inhibitor, or they can go on a low salt diet. And then here's the works cited. So that was my part of the slides, and Dylan presented his part. Thank you.